Cape Talk.
Cape Talk.
Call Lister now.
021 446 0567.
Welcome back. 25 minutes to 9 o'clock. Remember, it is an always open line here on the show. So whenever you find the fancy, you can give us a call with whatever's on your mind. If you want to respond to that interview with Baleka Mbete on Al Jazeera, or anything that you find interesting to talk to, please give us a call or drop us a WhatsApp on 072 567 1567. But a story came across my social media pages last week sometime. It was of an Irish gentleman who had passed away. He was diagnosed with a disease, and he knew his time was coming. And because he was somewhat of a prankster in his family, he wanted to leave his family with a little goodbye. And he had arranged for an audio speaker to be beside his graveside. And then as his body was being lowered into the hole, and after a little song where him had been sung, some music was played, he then played this message. Obviously, as I think is the ultimate goodbye to his family, who I must disclaim, they knew he was going to do it. I just found that it was absolutely sweet for finding this moment to have a final goodbye to his family.
Hello? 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 Let me out! Where the am I? Hello? Hello? Let me out! Dark in here! Is that priest I can hear? That crook! Let me out! Hello? Hello? Stop the man! Stop, I can hear you! Hello? Hello? Please! Who's there? Hello? This is shamey, I'm in the box. No, I'm front of you, I'm dead. You're gonna hear that. That's me. Hello again, hello. I just called to say goodbye. I'm going to die, I'm afraid to say hello again, hello.
Shame. It breaks my heart, but it's absolutely lovely. It's absolutely endearing. And I thought it was an absolute lovely way to say goodbye so that people could remember you and your spirit in the way you lived it on earth. The man's name is Shay Bradley. He was a man who was diagnosed with a terminal illness, and he knew exactly how he wanted to say goodbye. And that got us thinking, us here in the production team, how do we prepare ourselves for when we have to do a transition through death? And call it transition, call it dying, various ways, various euphemisms to call it. And I thought it would be quite an interesting discussion, and that's why we called to various hospices. We got through to Tygerberg Hospice, who put us in touch with Dr. John Kiley. He's a retired oncologist. He now does work with Tygerberg Hospice. He now joins us in studio. Dr. Kiley, thanks very much for coming into studio with us. A very special moment for people who know that their time is coming, and to plan and to say goodbye to their loved ones, isn't it?
Oh yes. It's a huge thing that's about to happen, and that's how we're involved, helping them to move towards that comfortably. Just by the way, Kylie is also Irish.
Well, very nice to know that. Death is a very tricky subject to talk about, a very sensitive subject. I know many people don't even like hearing it on the radio, to have discussions on death. Many people in my family want to turn away and just not even include this as part of the list of things that they would want to discuss. I, on the other hand, I embrace discussions on death. I have often ponder my own mortality. I ponder what happens at that moment of death. Is it necessary to become so philosophical about it, or you as a man of science, or you as a man of medicine see it as a purely physical physical act of being here and not being here?
No, I'm not going to talk about personal feelings, but from a professional point of view, this is something that varies and differs from patient and person to patient and person. It's as much as we deal with different personalities all the time. One has to acknowledge this in the whole sort of dying process, how the patients feel about it, how their families feel about it, and how it's handled as this approaches. There are different sides to it, but what we do in the hospice context is to take that into account, but not focus on any particular sort of religion, faith or conviction or whatever. That's an individual right of a patient. And we ask after that, just so we have some idea of what those realities are to them individually and personally. But we're just acknowledging the individual and his or her rights.
Dealing with people who are in hospice care, and I know you can only talk anecdotally, and people from the people and experiences from the people that you interacted with. Would you say that many people, especially if they've been diagnosed with a terminal illness, at some point or another reconcile with the fact that they will be dying in the near future, and that they reconcile with this fact? Or does talking and speaking about death with patients is still something hard to overcome?
Huge individual variation once again. There's some people who don't want to talk about it at all, and in fact ask the hospice nursing staff to please not park their cars right outside the door, because it says hospice on the side. And there are those who would like to talk about it, and everything between those sort of two extremes. It's very much an individual thing. We stick to our own professional sort of training and background. So we have nursing staff, social welfare workers, doctors involved, etc., and other groups of professionals. When it comes to religious issues, we have a voluntary spiritual counsellor who will, on request, go and see patients, and she will see anybody, be they atheist or staunch Christian or whatever, and to talk to them about it as much as they want to. And it's an individual thing. It's very important to the individual, but we don't prescribe to them in any other context than our professional context.
We're speaking to Dr. John Kiley. He's a retired oncologist. He does work with the Tygerberg Hospice. We are talking and reflecting on a video that sort of circulated last week of an Irishman who gave a final farewell to his family in a very comedic way as he was being lowered into the ground at his funeral. And we are talking about the, for lack of a better term, the art of dying, coming to terms with anyone's demise. And Doctor, when people are in their final stages and they're still able to communicate, do many people ask you, Doctor, what is happening to me now? Are many people interested in the actual physiology, the actual biology of this transition?
Not so much. I think I need just to draw attention to that I don't see any of these patients. Our nursing staff see them at home. And so I don't deal with them directly in the hospice context. I did previously in my professional capacity in state hospitals and in private practice. The patients seldom want to know what the actual process of events is. What they do like to know is, why am I feeling whatever it is? This pain, this discomfort, this shortness of breath, this anxiety, whatever it is. And what we can explain is that we do. What we can help with there, we do. Because that's the focus here. We're talking about the art of dying, which I think is a fairly good title in this context, but we lay a lot of emphasis on that at Tygerberg Hospice, on the fact that we're looking at quality of life,
Yeah.
which carries on until people die. So we focus on that, not on the fact that they will be dead. It's how they're getting there that really counts.
021 446 0567. We are taking your calls on this issue. Let's go to June in Newlands. How are you doing, June? Good evening.
Hi there. I'm so in agreement with what the doctor just said. My late husband had cancer, and I think in a way we were so fortunate to have the time to plan and say goodbye. And it's a difficult process. It really, really is. But I'm very grateful for what we had. I really am. I mean, the day that he passed away was not sad. It was just a goodbye. And in fact, when I left the hospital after he'd passed away, I put the radio on and I sang all the way home. And it just had this amazing sense of closure, because we'd had the time to discuss it and discuss what he wanted to do, and what he wanted for his funeral. And
June, was your husband able to verbally communicate until a very, very late stage?
Almost. Yeah.
Okay, June, thanks so much. Really, really appreciate your call coming in. Doctor, does it matter for a patient who is busy, who is currently dying, whether there are people around them? Does it make the person feel more comfortable, more at ease? I know that in my family we have a tradition of, particularly when older members of our family are in their last stages, there's people around them, but it's very solemn, very serene. It's quite religious. Many people singing hymns, not necessarily praying, but at least creating the very calming environment. Does it matter to a person?
I hate hedging away from giving sort of solid principles, because there are none that one can apply, other than the fact this is an individual thing. What is in your family is right for you, and for people in your family in those circumstances, it's right for them, and they're comfortable with that. Some people, I know, I've seen this, people have said, I don't want a whole lot of people around. My wife's here, or my husband's here, or my child, or my parent, or whatever. And that's all that I want. But there are others who are very comfortable with this sort of concern of a large number of people. But one has to look at practical aspects of that as well. It can be a problem when you're dealing with this happening in a confined space, in a small ward in a hospital, for instance. So once again, it varies from individual to individual, and you try to meet them where they are and what they want. It's never just the patient. It's the patient and family, all of those really close to the patient, the loved ones who are there and involved with this whole process. And it's what they want.
A question coming in on the WhatsApp line, questions regarding on essentially the process of dying. Some person asking, and I quite think a fortuitous, nice Freudian slip here. The brain is the last think to die. Which I think is quite appropriate. But also some questions of what can people still feel in terms of their senses. I know that there are some people who say don't talk ill, or don't quarrel, don't create any unnecessary drama around the deathbed of a person, because apparently, according to some people, hearing is one of the last senses to go. So therefore, something the person can still hear the tension in the room. From a medical and scientific point of view, is there anything that you can comment on that, on the last senses, the last senses or stimuli that a dying person can experience?
It's not a sudden trip of a switch or switches that all go together. It's a slow process. Interestingly, in South Africa, this became particularly relevant after the first heart transplant in December 1967 by Professor Chris Barnard. And after that, death definition started attracting a lot of attention for more legal than medical matters. When does somebody die? When the heart stops beating, when the breathing stops happening, when brain activity on an encephalogram doesn't show up anymore. It's very difficult to say. It's seldom that somebody dies in an instant. That's usually with some major catastrophic sort of car crash, smash type thing. But that's not the way people normally die from illnesses. It's a slow process, and we just like to keep it as comfortable as possible in every way, and that includes the emotional side.
When you talk about quality of life, is there a balance in terms of where a person would feel comfortable? I could be under medical supervision, being administered the medication that maybe keeps my pain at bay, but I don't feel emotionally happy being in a hospital ward, but I want to be at home in my own environment. At the same time, that's not a space that has the ability to provide those pain relieving medications. At what's the balance then that do medical practitioners then have to make between making the person comfortable in terms of emotionally comfortable and ready for their passing, and also ensuring that they are pain free as much as possible?
Yeah, it's a very relevant question as far as hospice is concerned, because that's what hospice tries to do. Generally speaking, to look after somebody where he or she wants to be at the time of dying, and what the family want. And I say family, it's those who closest and dearest. It's not a case of we can do this here, we can't do it there. Hospice makes that difference very often. And when hospice is available, for instance, on a patient who can no longer swallow but needs a regular dose of morphine just to control the pain, we've got people who will set up, our staff, hospice nursing staff, will set up syringe drives, so there's a constant slow administration of the necessary dose, not to knock the patient out, to knock the pain out, and allowing them to be where they want to be. For some people, hospice is fine. For some people, hospital is fine, nursing home is fine. Other people want to be at home as long as the family can cope.
From a medical side, how do you, if a person is unconscious, still breathing, but you can see that, how do you know if a person is in pain?
If they don't have the normal sort of means of communication, you'll pick it up from the general state and calmness, and if that is disturbed, more often than not, you will know there's a signal something is going on, and there is some sort of symptom, be it pain or whatever, that is causing distress, and do something about it. It seldom intervenes when we've got to that sort of stage where we're approaching the end of a protracted process.
Ismail says, hi, Islam teaches us that sight is the last sense to leave the body, as the eyes see the soul leaving the body. That's also why the eyes remain open after death. This is all based on Ismail's religious opinion here, but from a medical point, especially when it comes to people of various religions, some people, particularly of the Islamic faith, want to have the person particularly at home so that burial could be quite quick. Other people like to have lots of family around the person. In terms of dealing with all those religious sensitivities, particularly when it comes to a hospital or hospice environment, how do you deal with that?
Well, as we talked a little bit about this earlier, one can't ignore the religious side of things. It's extremely important and has to be taken into account. I remember with a Muslim patient who was dying with us when I was still at Tygerberg, and the family were pressurizing a little bit to get him home for that reason. and we had already had to limit the number of people visiting him in his single-bed ward because he was not even able to get enough oxygen because of all the people crowding around him, which could add to his discomfort. But we were worried about him going home and his pain no longer being controlled. This is years ago, before syringe drives were as common as they are now. And I spoke to his wife and I said to him, his pain will lose control. Well, we will lose control of his pain if he goes home, and there is no way we can give him what he needs but can't swallow and so on. And I said, but I understand your tradition and your customs and your belief and your community and your faith. So it's up to you to decide. And she said, well, what would you think? I said, I'd prefer to have him yet and to know from my point of view his pain was controlled. She said, then he'll stay here.
Yeah.
And she put his well-being above that particular aspect. It was in that particular case. I can't comment on any faith
and each case has its own merits.
Absolutely.
We have Iona on the line in Wyburg. How are you doing, Iona?
Hi, fine, thank you. I'd just like to ask the doctor a question.
Go ahead, he's listening.
Yeah. Good evening, Doctor. Doctor, I was with my dad when he died in hospice in Kenilworth about 25 years ago. And one thing's always intrigued me is that while he was in hospice, there was a man across the bed from him, and he was picking his arms up and bringing them down. And then after a while, the nurses came and they put a screen around him. And when they called me to say my dad was taking a turn for the worst about 6 a.m, and I got there and he was really, his arms were going up and down. And then when I got there, I said, Dad, I'm here. It's okay. And I could see that he was like, he seemed distressed. And I just said to him, look, you can go now. It's okay. Everything's okay. You can go. And he quietly put his arms down, and then he took a couple of breaths, and they got shallower and shallower and shallower. And then he just sort of looked up, and his eyes went very wide, and then his heart stopped. But why was he lifting up his arms? He had that mesothelioma, I think they call it, on his lungs. Was it the breathing?
Thank you so much. We have literally 1.5 minutes. Thank you so much for your question, Doctor.
Not a simple answer, but I think there can be agitation and stress that can cause some of these symptoms. It's not a common occurrence, but you will occasionally see some sort of reflex response to everything quietly failing, but it's more often than not some sort of emotional stress, and in fact comforting the way that you did is the way to handle a situation like that.
Doctor, if there's one thing that families can do at that time of passing to make themselves comfortable and of course their loved one, what would that be?
I think it's a big question.
I understand.
We see things happen where there are difficulties. There are clearly emotional crises happening for patient and all those very close and the loved ones who are very concerned. If they've reached peace, that's the thing that they need to get. Between them and the patient who's actually dying, there are very few, if any, problems. The death becomes a relief for the patient and the family.
I think that's a great way to end. Dr. John Kiley, the retired oncologist, thanks so much for coming in and helping discuss this very, very sensitive issue with us. Thank you so much.
You're with Cape Talk.
This is Lester Kivet Tonight.